Hi everyone, my name is Tanya Patron, physician assistant with Mammy Plastic Surgery. I have a patient here today and we're going to be filming a microneedling session. Microneedling is a treatment that we perform here in the office. It's for skin rejuvenation. So I'm going to numb my patient right now. We use a topical numbing cream. She's going to sit with that for about 10 to 15 minutes before we start the treatment. We're using a very small amount of this topical numbing cream so that we don't cause any reactions to the skin. A little goes a long way, so it's not necessary to use so much of it. So we just kind of spread it out nice and evenly so that way she has more comfort during the actual microneedling session. And I'm going to bring this down onto her chest as well. How are you doing? Perfect. So this actually absorbs very quickly, but we're going to let her sit for about 10 to 15 minutes. So I'm degreasing the skin. We're actually going to be applying a solution while we're doing our microneedling so that she's getting some extra rejuvenation. It's not just going to be dry microneedling, which means without a particular solution. The one that we use here has different growth factors in them, so it really helps to give more of an added benefit to the treatment. When you have microneedling, every time that you do a session, you get a fresh sterile tip. It comes in a baggie like this. And so we open a new one for each patient. So I don't know if you guys can actually see this on camera, but this is the needle tip. Inside the cap, there's several little needles there, and you'll see it start to oscillate when I turn this on. And if I dial this all the way up, those needles come out. I don't know if you can see that or not. So it's almost like a little tattoo device without the ink. So the skin is ready, and I'm going to start to apply my peptide gel. You're going to see me switch gloves quite a few times during the treatment so that we can make sure the area is always clean. I'm going to start on the chest, so I'm just going to apply this very liberally to the neck and chest. And that way when we're doing our microneedling, the peptide gel will get infused into the skin. This helps with the wrinkles on the chest and neck. And you can see I'm just making a little pattern here, which I'm going to go over again. She's had about, I guess, 6 or 7. How many sessions would you say?
I think I had 5.
Okay, 5. So this would be number 6. She's had really great results. She's been very happy.
Very good results.
So we're just going to continue with that. And you can see the skin starting to get nice and flushed, and that's exactly what we want. And that's the neck and chest area. You can see some tiny little pinpoint bleeding. That is not anything that the patient needs to worry about when she goes home. The redness is going to calm down. She can apply makeup to the area after 24 hours. So by tomorrow morning, she'll be able to go back to normal. So I'm just going to finish the rest of the treatment. So we're completely finished with our microneedling. We worked from the chest all the way up, also under the eyes, around the nose. I'm just going to kind of clean her up now. After you have finished your session, this is the time that you want to lather on some really great stuff. It's not a time to be super aggressive, so be careful with any products that you use at home. Just check with your provider first, but we're going to apply a few different things here to help calm the skin, to infuse the skin with some really good growth factors so she can get a maximum result.